So it's very important to note, and going back to what we talked about earlier, contrasting the Women's Health Initiative and the oral hormones that were used there versus the bioidentical hormones that we use today, it's so important to realize that progestins are not the same as progesterone. And so here we'll go through quickly the difference between the two. So synthetic progestins are chemically modified to survive oral metabolism. However, progesterone, because it is bioidentical, we actually want it to be metabolized down into that allopregnanolone metabolite so that we get all of those wonderful benefits of sleep and mood stability from it. Synthetic progestins can also bind to androgen, glucocorticoid, mineralocorticoid receptors. And so that can have a lot of impacts on other systems throughout the body, whereas bioidentical progesterone will only bind to progesterone receptors, which is ideal. As far as breast cancer risk is concerned, synthetic progestins are linked to a higher risk, as was seen in the WHI trial when using medroxyprogesterone acetate, versus bioidentical progestin is actually linked to a lower risk in breast cancer versus the combined products of estrogen and progestins in the WHI. From a cardiovascular standpoint, synthetic progestins can blunt the effects of estrogen, the positive effects of estrogen on lipid profiles, whereas progesterone is generally considered neutral with regards to cardiovascular impact. So it doesn't negate the good HDL cholesterol benefits of estrogen. On sleep and mood with synthetic progestins, a lot of patients were reporting mood swings, irritability, whereas again, with bioidentical progesterone, we know that it does have that calming and sedative side effect. From an endometrial standpoint, synthetic progestins are highly potent for thinning the uterine lining. If a patient is utilizing a synthetic progestin, it is often recommended to stop it if they are having heavy bleeding. However, with progesterone, we know that it does confer protection on the endometrial lining. And oftentimes progesterone is used to help stabilize patients that are having irregular bleeding.